Is that an STD?
Hepatitis B, the question was, is that an STD? Hepatitis B is the only one that you would, uh,
Why would you mess somebody say yellow?
because what happens is that,
They are attractive.
hold on.
So it's, you like
All right. The question was,
is that STD?
is it an STD? Hepatitis B is considered an STD because it can be caught. It's one of the ones that is sexually transmitted. Okay. Hepatitis A, on the other hand, listen up, guys. I'm
Don't
giving
stop
you
talking.
important information. Okay. Hepatitis A is by contaminated food and water, and this is usually you're gonna find this in people that work in the industry, restaurants. They go to the bathroom, the virus is shed in the stool. Okay, so if you don't wash your hands properly and then you go back and you don't wear those plastic gloves and prepare somebody's food or are preparing food, this is how it gets transmitted. Or water gets contaminated with fecal human material and you drink the water and that's how you get it. Okay, that's why hepatitis A nowadays is not as common, because now we have all these things about washing your hands, making sure that we post the signs out there for all the employees, you need to wash your hands. So that's why. Hepatitis B is sexually transmitted. It's also transmitted via the use of dirty, contaminated needles, because it's also transmitted via the blood or any body fluid that can carry the hepatitis virus. Okay, and hepatitis C is also via blood and contaminated needles. But again, hepatitis C, unfortunately, you don't get the same signs and symptoms that you do with A and B. Okay? All right. So let's move on. Last time we talked about the parts, okay, of a word. We said we have word roots, combining forms, suffixes, and prefixes. We talked about it's a puzzle. We talked about your word roots. Word roots usually, but not always, indicate the part of a body involved. We gave examples of cardi, which is heart, gas, which is stomach, nerve, which is nerve. Okay. And then we started talking about combining forms. We said that your combining forms, we create them by adding a vowel, which is usually the letter O, but you will see other combining vowels as well. We use it when connecting word roots or when the word root is joined to a suffix that begins with a consonant. So the rule here is, if your suffix begins with a consonant, you need to have a combining form in order to attach it to the word root. Okay? And we discussed that last time. Examples of combining forms, we have cardi and then /o, which means heart, gast /o, stomach, and nerve /o, nerve. Who can give me an example of a word using the word gastro? Huh?
Gastroenterology.
Gastroenterology. Very good. It's gastroenterology. Give me another one. Come on, you can do it.
Gastroesophageal reflux.
Gastroesophageal reflux. Very good.
What?
What else?
Gastroenterologist.
Gastroenterologist. How about gastritis? How about
Did I say
gastritis?
gastric? Gastric.
Gastric? What's
Yeah.
gastric?
Gastric bypass. What is it?
Gastric bypass. What is it?
I don't know what that is.
You don't know what gastric bypass is?
No.
Gastric bypass is when we're literally bypassing part of your stomach, okay? And we go directly into the intestine. For instance, when we have people that are morbidly obese, okay, anybody who is over 300 pounds in weight, and they can't lose the weight, and so now they have heart disease, they have diabetes. I mean, they're literally walking time bomb. These people are actually having gastric bypasses, or they're having another procedure called the gastric sleeve.
Oh, that's
Oh, yeah.
Okay. No, what they do is they make your stomach smaller. Okay. In the gastric bypass, they literally remove and they leave you with a little pouch. Okay. That's why these people lose, in the first couple of months, they lose so much weight because now instead of being able to eat a whole plate of food, they're cut down to ounces.
Oh,
Literally ounces.
y'all only eat the
Yes.
bottom burger. I'll be
Okay? So yeah. But if you eat healthy and you exercise, you will not get there. Now remember, there's people that actually have issues with thyroid problems. They also have other issues where their bodies cannot get rid of fat the way their metabolisms aren't working properly because they have a condition or a disease that is not allowing them to do that. So, you know, it's not a lot about them not wanting to lose the weight, but it's they have other diseases or conditions that are not helping them do that. Okay? All right. Here we looked at the picture of combining forms, okay? Where we saw how we could combine forms by looking at what parts of the body, okay? And then they're showing you their area of the brachial, okay, where your arm, and then the neck, where you have your carotids, okay? So those are just some. So now we're talking about your suffixes, okay? They're usually, but not always, indicating a procedure, condition, disorder, or disease, okay? I'll give you an example. We said leukocytes, okay? We said leuko was what?
Yellow. No, that's not yellow.
White. Very good. What is cytes? Cells. So now we're saying we have a cell that is white. Give me an example of a white cell. Give me an example of a white cell. Think about it. We have 5.
We do.
Yes.
It's in our bloodstream, right?
They're in our bloodstream.
White blood cell.
We have 5 different types of white cells.
White blood cell.
That's a leukocyte. How many times? Give me an example of one. Nobody.
What are you trying to say? Like, there's 5.
All right, here we go.
I don't remember that.
We have, for those of you that are in PCT, 5 types of WBCs or leukocytes. Okay? They are neutrophil, eosinophil, basophil, lymphocyte, and monocyte. Okay, those are your 5 white blood cells. Neutrophil, eosinophil, basophil, lymphocyte, bless you, and monocyte. Okay? Those are your 5 white cells. We divide them into 2 categories. Okay? We divide them into 2 categories. These are granulated. Why?
Mr. Trimble,
Yeah.
could you send Madeline Estrada to the office for another dismissal, please? Thank you, sir.
Thank you. Madeline is here.
Wait, what's the?
All right. So, neutrophil, eosinophil, basophil. Okay? The first three are considered granulosized or granulated. Okay? Why? Because they have granules in the cytoplasm. Okay? That's why they're called granulocytes. Yes, ma'am.
What's a granule?
Granules, they're little, they're almost like little rocks that are found inside the cytoplasm of the cells. And I'll look for a sample and show you a sample. Okay? And these are gonna have your eosinophil. The granules are gonna have an orangey reddish color to it. That's why it's called eosino. Eos means reddish, orange. Okay. So they have a reddish color to them, orangey when you see them under the scope. Your basophils, the granules are larger and they're purple. They're a nice deep purple color and they're much larger. Okay, that's what your basophils will look like. Your neutrophils, also known as segmented, okay, or segs, do have granules, but they're smaller, and their color is like a light pink color to them. But what stands out is their nucleus. Their nucleus is not round, and that's why we call it segmented. The nucleus is cut into little lobes, and they have 7 lobes. You can actually see the 7 lobes where they're pinched. Okay, that's what we call them. That's what we call it, segmented. This one right here. And then your lymphocytes and your monocytes are your agranulocytes, meaning that they don't have any granules. Okay? They're your agranulocytes. Okay? Those are your 5 white cells. Okay. So, once you guys are done, then we'll continue up there. They have 3 examples. Cardiomegaly. Cardio is your root word. If you notice, what is putting together your word root with your suffix? What's in between them? The O. That is your combining vowel. Okay? Megaly, what does megaly mean? Large. Very good. You need to start remembering them, okay? Now the next one says gastralgia. Did we use the combining vowel here? Why? Huh? Why doesn't it need it? You're right, it doesn't need it. Why?
The
Good one.
A is shared
What did we say? What did we say? We would add a combining vowel if our suffix what?
Started with a, am I right?
I started with a what?
Started with a,
Consonant.
Consonant. Very good. So if our suffix begins with a consonant, that's when we're going to use a combining vowel. In gastralgia, we don't use it because algia begins with what?
A.
With an A. Okay? Very good. What is algia?
It's a painful condition.
Pain. So gastralgia means you have pain where?
in your stomach.
In your stomach.
So when
Okay.
you say you have a stomach ache, that's basically what you have.
Yes.
I got
Gastralgia. Now you can go home and tell your mom, Mom, I have gastralgia. That's right.
You're right.
Now the next one is neuritis. What is neuritis? Inflammation of a nerve.
I said cells.
Did we use, so it's inflammation of the nerves. Did we use a combining vowel?
No.
Why?
Because it starts with
I.
With a vowel, so we don't need another vowel. Very good. Okay, remember, we only add a combining vowel if our suffix begins with
A
a
consonant.
consonant. Very good. Good job. Here we go. So these are examples. This is a puzzle. And remember, making medical terms is a puzzle. that you're gonna say, and you either attach a suffix to the word root or you attach a prefix to the word root. You're gonna find out that sometimes you have all three. You have a prefix, a word root, and a suffix. Okay? And we're getting there. Yes. Here is your prefixes. A prefix usually but not always indicate location, time, number, or status. Give me an example of a prefix that is a number.
Oh, wait. Let me quiet. Number. Hold on, it's the last page.
Give me an example of a prefix that means a number.
Nully.
Nully? What's nully?
None.
None, zero, okay? What about quadra? Four, okay? Those are your numbers. Quadriplegic means what?
So you just say
Four. Quadriplegic means what? Quadra means four, and now we're using it in the word quadriplegic. What does that mean?
four palsy. Please. No, the plegian.
Quad is four. Plegia means what?
Palsy? That's a plegian.
Unable to move.
Oh.
A quadriplegic is one that is completely immobile. They're paralyzed from the neck down. That is your quadriplegic. Okay? When you say hemiplegic, we're talking what? Half up, okay? So it can be from the waist down. All right, so here we have pericardium. What does peri stand for? What does the suffix peri mean?
Period of time. That's a around.
Around, very good. So we saying pericardium, we're saying what? Around the heart. Very good. Good job. How about epigastric? What is epi? What's epi? Epi is above, so we're saying epigastric. What are we saying? Above the gastric, above the stomach. Very good. Polyneuritis.
Many nerves.
Poly is what? Many. So it's polyneuritis.
It's many nerves there.
Okay, so you're right, and we would say inflammation of many nerves. Okay. Now remember, I told you you're gonna have both. Look at polyneuritis.
Oh, polyneuritis.
Very good. Okay. This is a perfect example of where you have a prefix, your word root, and a suffix. Okay. Itis is your suffix. That means inflammation. Neur is your word root, which means nerve. And poly means many. Okay. Polyneuritis. That is the perfect example of where you have all three of them in place. Can you all see it now? Does that make sense?
Yes.
Okay, very good. We're gonna move on. So here's your puzzle. Okay? You have your prefix plus your word root and the suffix, and you put it all together. Okay? Determining meanings on the basis of word parts. We're gonna describe medical terms based on their word parts. Okay? When you're reading the words, we always begin with the back part. Okay? So, for instance, cardiologist. What is your root word here? Cardi. What is your suffix? Logis. And what's your combining form? Oh, very good. So when you're gonna tell me what it means, we start where?
The end. The study.
One who studies The heart.
Oh, okay.
So we start from the end to the front. Okay? So we say cardiologist is one who studies the heart. Logis means studies. Cardi is heart. And so we say that cardiologist is one who studies the heart. Gastritis. Inflammation of the stomach. We don't say stomach inflamed, right? Or enlarged. We say inflammation of the stomach. So we're always going to start from the back and work our way up to the front. Neuralgia. What's algia? Pain. Pain in the nerves or pain of the nerves. Very good. Does that make sense now, guys? Okay? So that's how you're going to read, and that's how you get the meaning of the words. Okay? All right. So here is an example to take apart. We just took the other ones apart. They gave you gastro, what is it? I can't read it over here.
Oh, it says
Oh, ortho. Yes, I know which one it is. All right, so they have broken it up for us. In this one, rhino, okay, you have oto, rhino, laryngologist. There you go. An laryngologist is one that studies the ears and throat and nose. Nose, throat, and ears. Okay? So that's one who studies ears, nose, and throat. Very good. Okay? Why do we study ears, nose, and throat at the same time?
because
They're all connected together. Very good. They all go into the same spot. That's why when you get water up your nose, you feel it that in your throat. Okay? Or if you swallow the wrong way, you'll feel it up here, sometimes in your ears, because of that reason. Okay? Very good. Additional lessons in this chapter. Okay. So we will be using our medical dictionaries. We're going to look for sound-like pronunciation systems, why spelling counts, and caution when using abbreviations. Do we have any questions so far? Here's another one that you all need to remember under your rules for combining forms. Listen up. We also use a combining vowel when you're going to put together two or more word roots together. I'll give you an example. Gastroenteritis. I'm coming. I will show you.
Can you repeat it?
Yes. Gastro. Enteritis.
Oh, I heard that word.
Okay? Here, yes ma'am.
What page are you on?
I'm on page 5. Page 5. Page 5 of chapter 1. Okay? Rule number 3. It says a combining vowel is used when two or more word roots are joined. Here, our suffix is itis. Gast is one of our root words. Combining and enter is another word root. Okay? So you have gastroenteritis. What is gastroenteritis?
What is it? I don't know what.
Inflammation of the intestinal tract. Okay? Not just your stomach, but the whole, your large and small intestines. Okay? Entero means small intestine. Okay, so itis is inflammation, gastro, stomach. Okay, so we're saying that there is inflammation of the small intestine and the stomach.
If enter means small intestines, then why does a gastroenterologist work with all of it?
Because entero can be used for both the small and the large intestine. And your gastroenterologist is going to see all of your stomach area. We're not going to just say, oh, I'm just going to do stomach and small intestine and leave your large intestine out of the picture, because they're all interconnected. Okay? So can you see now how we rule number 3 works? Okay? There's another example there that says, I know that's the only one they give you, and they just divided it. Okay? Questions with this one?
No.
Okay. What is pathology? Let's see. What is pathology?
Study of diseases.
The study of what?
All of the aspects of disease.
The study of diseases. Your pathologist does what? What does a pathologist do?
Study diseases. They look at the bacteria involved in diseases and how to cure it.
They find out what disease you got so that you could try to cure it.
You know that pathologists only see you when you're dead, right?
They get to see what happened.
They get to see what went wrong.
They do an autopsy.
Your pathologists are the ones that are going to do autopsies, okay? Your pathologists usually see you once you're dead. Sometimes they see you before, like for instance, if they have, if they find a mass in your intestinal tract, okay? And they go in there and they pull out a small sample, then they send it to the pathologist so that the pathologist can check it and tell them if it's a cancer or not. Okay, so your pathologist has a dual job. He sees patients after they're dead to find out what they died of, okay? And then he also is the one that's going to do the testing of samples that come from physicians so that they can find out what's wrong with the patient, okay? So he does that.
So technically you don't beat your pathology.
No, if you're in a hospital, no, you won't usually see your pathologist. You'll just see a chart for the pathologies. But yeah, unless they have the pathologist come in and talk to you about and explain. But that's usually what your doctor would do. Okay. All right. So we determined the meanings on the basis of word parts. We took your words apart. Okay. And we said that in order for us to define the word, we start from the back and move ourselves forward, okay? We have it here. Gastroenteritis, we said there is an inflammation of the stomach and small intestine, okay? Questions so far? Okay. All right. So I'll write it for you on the board. Okay? Hysterectomy. It's the removal of your uterus. Hyper, you have excessive and increased. Give me an example where we can use hyper to mean increased.
Hyperactive.
Hypertension, hyperactive, hyperactivity. Very good.
Hypertonic.
Hyper what?
Tonic.
Hypertonic. Very good.
Oh, yeah.
What does hypertonic mean?
When the cells get bigger with the water.
Why?
With the
Oh, it's an excessive amount of
the solu pumping.
Very good. Okay. All right, let's go move on to the next one. All right, hypo, deficient, decrease. Give me an example of hypo. Use it. Hypotonic. Hypohydration. How about hypotension? What is hypotension? Low blood pressure. Okay, very good. Others, we know it's inflammation. Osis, abnormal condition of disease. Give me an example. Use osis meiosis. What is meiosis?
It's in the cell division. It's in the during the cell division when the guy.
It's for when you're like you have this chromosome. You have
Oh,
the
yeah,
girl
yeah.
chromosome and the boy chromosome, and you mix it for the child.
So it's a cell division, right?
Double helix.
Very good. Okay. Ostomy is the surgical creation of an artificial opening to the body's surface. This ostomy in this case means that we're going to create an opening for you to either be able to, for us to be able to put in food, okay, or for you to be able to speak. Otomy is a cutting surgical incision, plasty surgical repair, and rage is bleeding abnormal excessive fluid. Okay? Here are some other ones. Raphe, surgical suturing. Rhea, flow of discharge. The word left me. Rhexis, rupture. Sclerosis, abnormal hardening. Give me an example of the using sclerosis. No. Those of you in principles of health science should know one of these. Abnormal hardening of the veins or arteries, actually. Abnormal hardening of the arteries. Give me the words. Nobody knows? Arteriosclerosis. Very good. Arteriosclerosis is the abnormal hardening of your arteries. Okay, arteriosclerosis. Atherosclerosis is the other one. Questions so far? Okay. A vertebra is a bone in the spine. What is the plural of vertebra?
Vertebrae, yeah.
Yeah, vertebrae.
Which one?
See,
Okay, very good. So when we're forming plurals, guys, here we go. Your guidelines for forming plurals. And they're on table 1.6 of page 12. You need to know these. You need to know these. The first one. If you have the singular form that ends in a suffix a, you're going to form the plural by adding ae. Okay? So vertebra, vertebrate with an ae, letter C. Okay? That's your first rule. And you have them there on page 12. If it ends with an A, we're going to make it plural by adding ae. Okay? Rule number 2. If the singular term ends in the suffix ex or ix, we're going to change it to ices for the plural. So appendix, if I'm ending in ix, what would be the plural of appendix? Appendices. Very good. ICES. If I say index, what is the plural? Indices. Okay. INDICES. Okay. Anytime that we end in an EX or IX, we're going to change the plural form to ICES. Okay? So this is what I want you to do right now. You need to make sure you write down your guidelines. Okay? I'm going to give you time to do that. Guys, let me have your attention real quick. And then you can continue writing. On page 10, let me go over that real quick because it is very important. It's called your sounds alike. Okay? But it's spelled different. The first one is, if it sounds like an F, it will probably be an F. The example is flatus. Okay? But the other example is phlegm. It sounds like an F, but it's spelled PH. Phlegm. Okay? So you need to be very careful when it sounds alike, but it's spelled different. May sound like an F, but it's spelled like a PH. The example is phlegm. P-H-L-E-G-M. The other one is if it sounds like a J, but it may be a G or it may be a J. Example, gingivitis. It sounds like a J, but it starts with a G. Jaundice. Jaundice starts with a J, sounds like a J. So what you need to do is make sure that you put those examples also down, because you need to make sure you learn and you understand that it may sound like this, but it might be written this way. You're just going to have to be very careful to remember how words are spelling, basically. Okay? For instance, you have psychologist. How is psychologist spelled? PH. It just sounds like it's an S, but it has that PH in front of it. Okay? So, it's, again, I need to learn to identify the words, the spelling. Okay? Because you're going to have them. So, make sure that you also do that table on page 10, 1.5. Okay? Any questions? Okay, so go ahead and finish up your guidelines and then do page 10, table 1.5. And then you should have already written your rules on page 5, table 1.3. Your combining forms. You should already have those, okay? But I put it up there just in case that you don't have them. You need to know those 3 rules as well. Okay?
In the PowerPoint, right? Okay,
yeah. I am going to attempt to put this PowerPoint onto the video so that you guys will have the PowerPoint along with the video and help you go over. Questions, guys? Anybody have questions? Okay. Guys, make sure you pick up your assignments. Everything that is graded is in the Manila folder. If you owe me work, put it on top of the Manila folder. Don't put it inside. Because if you put it inside, then I'm not gonna know it's in there. All your work that you need me to grade needs to be on top of that Manila folder, okay? All your graded stuff is inside the Manila folders. Make sure you pick it up. Okay? So if you owe me anything, turn it in, guys. I gotta put all your grades up there.